Good evening, class. My name is Jorge, and I will explain to you about Helicobacter pylori. It's a gram-negative bacteria. It's present in about 50% of the population in the world. And the most common route for infection is oral-to-oral infection, feces to oral, or through contaminated food or water. The effects on tissues. Right here we have an example. This is the bacteria, and this is the gastric mucous gel. So because of their shape, it's able to enter, and then it gets protected by the gel, so the acid doesn't take any effect on the bacteria. And here we see the bacteria inside of the cell, and because it's not in total contact with the skin, the immune system is unable to kill it.
With the mucous membrane.
Mucous membrane, I'm sorry. A chronic infection causes atrophic and even metaplastic changes in the stomach, can lead to problems such as ulcers in the stomach or duodenum. Something interesting is that the acid stimulates their propagation, and they produce ammonia to regulate the pH where they are surrounded, and vacuolating in cytotoxin, and both things are toxic to epithelial cells.
So it's very interesting that that they control the pH in their immediate environment by producing alkaline substances
Yes.
which interacts with the acid of our stomach, and that the acid of our stomach makes them reproduce more.
Yeah, it's a hydrochloric acid, and it's incredible that they can live inside the stomach. And then we have the symptoms. Generally, most of the patients is asymptomatic, so no specific clinical signs, and have been described when signs or symptoms are present. They may include the following: nausea, vomiting, abdominal pain, heartburn, diarrhea, hunger in the morning, and halitosis. Halitosis is the breath, bad breath. And then we have diagnosis. They have different tests. One is H. pylori fecal antigen test. So you have to provide a stool sample. And then they have the carbon-13 urea breath test. When the bacteria is present in the stomach, it's going to release gases. So they use this test to check if it's present in the stomach or not. Then we have a H. pylori test in blood. So they have to do a process, and they're going to say yes or no. In some countries or some specific locations, they do an antibiogram because they're resistant to some kind of antibiotics. So that's in special places. They used to control it, what is called a triple therapy regime. They use something to control the acid in the stomach, to reduce it, and they use a combination of two antibiotics. So as an example, they have omeprazole, amoxicillin, and clarithromycin for 10 days. They have bismuth, subsalicylate, metronidazole, and tetracycline for 14 days, and lansoprazole, amoxicillin, and clarithromycin for either 10 or 14 days. This is not the first choice of treatment. Those two, this one is the most common than this one, and some places, some geographic locations is this one.
That would be clarithromycin.
Clarithromycin.
No, mycin. Mycin would be Spanish.
Yeah, Spanish, okay. Clarithromycin. And that's my reference.